Hi, this is Dr. Reddy with One Life Psychiatry. I just like providing educational videos. This is a topic that I've always thought about in terms of why do people smoke, right? And so that's what I'm going to talk about. So, recent studies show that approximately 40 to 43% of adults with ADHD, typically untreated, because nicotine essentially converts to dopamine. And so that's why, if you think about it, why would someone that smokes cigarettes as a stimulant feel relaxed? Well, so for a person that has ADHD and how their brain is developed, um, extra dopamine indirectly through nicotine makes them put a pause on their thinking, meaning they think more logically, they can rationalize things better. And that's essentially kind of the same premise of why people take stimulants, to provide them a little bit of a boost for things that they find mundane or they can't concentrate. And so that's what really a smoke break is, but it doesn't really seem like a break, because when you take a coffee break, would you take 4 espresso shots to feel relaxed? No, but a lot of people that do smoke cigarettes or vape, especially at nighttime, have a hard time sleeping because it is a stimulant. Um, so this is kind of further into the study. Um, so the general population in terms of smoking, it's about 19% to 20%. Now, this is also why, drug use when someone has untreated ADHD is much higher. So they're seeking an outlet for getting dopamine. So how do I make my brain feel some pleasure? So at least impulsive behaviors like binge eating, drug use, alcoholism, many things. So seeking kind of that chase for the dopamine. So kind of double the amount as compared to the normal population, which in my opinion, I see it more often as when people do smoke, there is a really high correlation, because when I ask them why they do it, they don't really know. They say it helps them relax, or it helps their mind decompress, or but then when I ask them, well, does coffee do the same thing? They're usually no, it helps them concentrate, but it doesn't make them relax. It makes their brain function better. And that's kind of why I see that there's a connection between why people vape or use cigarettes and what does that do. So it gives them dopamine that their brain doesn't have enough of, to help them concentrate, focus, relax, unwind, not let their thoughts get, too overwhelming, right? How many things I have to do, all those things. So clinical studies show that individuals with untreated or severe ADHD are 2 times to 3 times more likely to initiate daily nicotine use. And when it comes to chemical dependence, um, it depends really on the person's circumstance. So there's a lot of people that can use alcohol or drugs to be functional, and some can't. So it really depends on many factors beyond just this one study. So people using nicotine indirectly get addicted fast, because the nicotine they get from vaping, it only doesn't last very long. So it's there in your brain and it's gone, and so then that's the repetitive nature. Um, so why does the ADHD brain self-medicate with nicotine? Because one, there's a lack of awareness that more people have ADHD than they even realize. So because they've been told, or they're dumb or lazy, or uh, just stop making excuses, when it's actually how their brain is designed. Um, so so smoking seems the logical sense for understimulated brain, right? Because ADHD, they thrive off like and dislike. So ADHD is a fundamental disorder of dopamine dysregulation. The ADHD brain operates with a lower baseline level of dopamine, leaving the individual in chronic states of neurological thirst. Hence, whatever they could find that'll satisfy it. And especially nowadays with vaping, it's easy to just vape kind of wherever. Um, and that's why quitting nicotine is the hardest, because it's always around you. And so you could vape in a car, but you can't drink and drive in a car, right? So it's masked a lot of society, but that's where the DA and the DA basically regulate the person has to be 21 over to buy nicotine. So, so nicotine is a highly efficient temporary crutch because it functions exactly the same as stimulant medications. That's the key, right? So you have to get enough nicotine to get a morsel of what Ritalin does. So hence, you have to keep smoking more and more. So this is the key way that it does. So nicotine molecules perfectly mimic acetylcholine, which drives the trigger for immediate artificial surge of dopamine along the brain's rewards pathway. The focus trap. The flood of dopamine temporarily clears brain fog, anchors executive function, and calms internal restlessness. Right? So when someone smokes, they do feel calm, right? But that's only because they have ADHD, and that's kind of the way that it helps them. In indirectly. So that's why you see people, you're like, why do you smoke? You know, and they don't really know. Um, just to clear my mind, but that would also mean that maybe they're getting some dopamine so that they don't feel as mentally foggy. Um, so how does stimulant make someone relax? It sounds paradoxical, stimulant and relaxing. So in the central nervous system, stimulants can cause physical relaxation, but this paradoxical effect highlights how ADHD neurochemistry differs from a neurotypical brain. There's quieting in the chaos. A neurotypical brain, a stimulant like caffeine or nicotine push an already balanced dopamine into overdrive, causing jitters, physical activity, hyperactivity, anxiety. Right, so that's a neurotypical brain. Um, in an ADHD brain, the stimulant raises the abnormally low baseline to a normal level by satisfying the brain's hunger for stimulation. The constant internal background noise and racing thoughts and physical fidgetiness shut off, producing a sense of mental calm. Nicotine's dual mechanism. Nicotine is unique amongst stimulants. While it activates the sympathetic nervous system, increasing heart rate, it simultaneously triggers a release of serotonin, beta endorphins, and GABA. The unique chemical combination creates an alert relaxation and sharpening focus while actively dampening physical activity. So that's a way you could understand how nicotine influences someone with ADHD to smoke and that whole reward cycle. So I just want to provide that information. My next topic is going to be about why do teens vape so much these days, and I'll go over that soon.